The Hawkins test is a clinical test used to diagnose impingement of the rotator cuff and other structures in the shoulder joint. It is named after Dr. Kennedy Hawkins, an American orthopedic surgeon who described the test in 1980. The test is typically performed by a qualified health professional who has received appropriate training in musculoskeletal assessment. During the Hawkins test, the patient's arm is positioned with the elbow flexed to 90 degrees and the shoulder abducted to 90 degrees. The examiner then stabilizes the patient's elbow and forearm and forcefully internally rotates the patient's arm. If this movement causes pain or discomfort in the shoulder, it may indicate impingement of the rotator cuff or other structures. The Hawkins test is often used in conjunction with other clinical tests and imaging studies to diagnose shoulder injuries and determine appropriate treatment plans. In general, the Hawkins test is used when a patient presents with symptoms suggestive of shoulder pathology such as shoulder pain, limited range of motion, and weakness in shoulder. This Hawkins test is for qualified health professionals who have received appropriate training in musculoskeletal assessment. It may be helpful for physicians, physical therapists, athletic trainers, and other healthcare providers who work with patients with shoulder injuries or conditions. To use our free Hawkins test, follow these steps. Download our Hawkins test from the CarePatron platform, which you can find in the link in the description. Instruct the patient to stand or sit upright with the arm to be tested at the side of their body. Next, flex the patient's arm to 90 degrees at the elbow and elevate the arm to 90 degrees at the shoulder so that the arm is parallel to the ground. Place one hand on the patient's forearm to stabilize the elbow and prevent movement at the elbow joint. On the other hand, internally rotate the patient's arm by pushing down on the patient's wrist, causing the shoulder joint to rotate inward. During this movement, note any pain or discomfort reported by the patient. The Hawkins test is typically scored based on the presence of absence of pain or discomfort during the test. A positive test indicates the presence of impingement, while a negative test suggests the lack of impingement. Here is a sample of our Hawkins test, which you can find on our CarePatron platform. To find our Hawkins test, go to our CarePatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at CarePatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our CarePatron channel or click on one of our recommended videos.